One of the most important things that I can do is to continue to communicate with the press and the public in a transparent and timely and responsible manner. I'm not going to hesitate to do that, so it's likely that we'll be seeing a lot more of one another in the coming days and weeks. Let me start by saying that the risk to the general public remains low, but as public officials charged with the safety and welfare of the people of Illinois, we take that risk seriously. Earlier this morning, I, along with governors across the nation, was on a call with Vice President Pence and health officials in D.C. Dr. Ezike and I are in constant communication with our federal and local lawmakers. It's our top priority to ensure every level of government is working collaboratively to keep our residents safe. Today, I will be talking to the CEOs of the largest insurance companies in the state of Illinois about the accessibility and affordability of testing and care. The Illinois Department of Insurance will be issuing a letter to insurance companies to let them know that we are on alert for any price gouging or unfair coverage practices and reminding them of their obligations under the law in terms of coverage of insured and underinsured patients. We're increasing staffing at our Office of Consumer Health Insurance toll-free line to ensure that Illinoisans know their rights, whether fully insured, uninsured, or underinsured, and that hotline can also help individuals determine their insurance coverage. The number for that hotline is 877-527-9431. And I'll repeat that again later in this news conference. We're also drafting guidelines for nursing homes and for state employees who work at facilities that serve our most vulnerable populations. Illinois was the first state and remains one of just a few states nationally able to test for COVID-19. And over the next few days, we're expanding to 2 additional testing labs beyond Cook County in Springfield and in Carbondale. Additionally, following the recommendations of the CDC and in lockstep with a few other large population states, we're beginning voluntary testing at select hospitals to gather statistics on the presence of the virus in our communities. The 2 Illinois cases that we had confirmed in January were successfully contained, and both patients have fully recovered and returned home. We now have 2 additional patients who have been confirmed to have the virus. The 4th individual announced today is the spouse of the 3rd individual who tested positive over the weekend. The 3rd individual is a man in his 70s, is isolated in a hospital, and the 4th individual, a woman in her 70s, is isolated at home. Both are in good condition. Federal, state, county, and hospital level public health officials are working to actively identify any individuals who were in contact with this couple. And to be clear, they were a husband and wife, a couple. Our Illinois Department of Public Health has launched a statewide COVID-19 coronavirus hotline and website to answer any questions from the public or to report a suspected case. That phone number is, and this is different than the one earlier, that phone number is 1-800-889-3931. And online, you can go to idph.illinois.gov. And I'll repeat these again later as well. I want to be clear that the best thing that the general public can do at this time is to continue taking the same precautions you take during flu season with renewed vigilance. Take extra care to wash your hands. Stay home if you are sick. Cover your mouth and nose during any coughs or sneezes. Clean, often touch objects and surfaces frequently. And please visit a doctor if you are experiencing any symptoms, particularly if you or a loved one recently traveled abroad. Illinois has one of the nation's leading public health systems, and our experts have been proactively preparing for this situation. Our Illinois state and local agencies and officials have decades of experience in developing responses and preventative measures for outbreaks. And since the earliest days of my administration, my agency directors have been coordinating preparedness throughout the state for any and all emergency situations. Last August, I'll remind you, our Illinois state agencies partnered with the U.S. Department of Health and Human Services and FEMA to run a contagious disease simulation exercise for potential outbreak situations. We are ready to put the weight of the state behind a full-fledged response when needed, and if we meet those thresholds. As it stands, the risk to the general public remains low. What's more, I want to emphasize that this virus isn't specific to any one ethnicity, nationality, or population. Just today, I joined Representative Ma and Senator Munoz to dine and shop at local businesses in Chinatown. Over the past few weeks, misinformation has caused business and foot traffic to drop significantly. And that's bad news for the restaurant and shop owners and everyone that they employ. So please join me in enjoying all that the neighborhood has to offer. And now, to talk more about the medical components of the virus and what precautions to take for you and your family, I want to introduce IDPH Director Ngozi Ezike.
Thank you, Governor. Thank you for your attention. So thank you for covering this very important situation. I'd like to thank Governor Pritzker for providing the resources and the support we need to respond to this novel coronavirus, COVID-19. So again, as you've heard today, we did announce a fourth individual in Illinois who has tested positive for COVID-19. While CDC will have to perform confirmatory testing for this presumptive positive, every precaution is taken because we do believe in our lab results. The fourth individual is a female in her 70s, and just as we had in our first and second cases, this is the spouse of the third case. The third case is hospitalized and in isolation, and the fourth case is at home in isolation. Public health officials are on site at the hospital. We have federal CDC GO team on board. We have our local health department. We have the state health department employees. We're all conducting interviews, working with the hospital administration to identify all the potential close contacts to both the third and the fourth cases. So we're working with the healthcare workers to ensure that we prevent additional spread of the virus. And in cases this involves keeping healthcare workers at home who were in contact with the patients. We are using every tool and every resource at our disposal to contain the spread of this virus. We are still in containment mode. I really want to thank our local health departments and our hospital partners for just the intense collaboration and cooperation. We've been on site all day Saturday, Sunday, they're there now, and we really want to thank our CDC partners. We continue to respond to this outbreak in full force. The risk does still remain low. We have these 4 cases that you're aware of, and we will continue to be monitoring the situation, and we will update you if anything changes. It is possible that there will be additional cases, but we are working to minimize the spread in the best possible way. As you heard about also on Friday, we are starting today with our Sentinel surveillance. This is an aggressive strategy to go out and be looking to see if there's community transmission or not. And so we're taking samples from the community, from people who agree to participate. If they present to a hospital or emergency department and have flu-like illnesses but test negative for the flu or test negative for other common respiratory viruses, they can be tested for coronavirus. And it's with that kind of surveillance that we will be able to see if we have circulating virus in our communities. So as we identify any cases, we may not. If we do, we'll be sure to notify you and let you know of what our future and next steps will be. But again, the risk to the communities of Illinois is low, and we will continue to work collaboratively with our local health departments and our federal partners to ensure that we're doing everything we can to be ready for whatever is around the bend. Thank you.
We got questions. So for starters, where exactly will this surveillance or whatever you're calling it at all hospitals, all doctors' offices? I mean, that seems kind of crazy. Can you explain?
Yeah, great question. So we're starting off with some pilot hospitals to start with. They are here in northern Illinois, and in short order, we'll be expanding to different locations in southern and central Illinois.
Can you give us a specific list? And
We can. I can give that to you offline. Sure.
Okay.
Is the information being pushed out in several languages? Spanish?
Yeah, we are trying to reach out. I'm trying to do a media in Spanish. We have a lot of our documents that have been translated into Chinese. And so if there are other requests, we will work on getting all of those things translated.
Also, is the age of these 3 or 4 individuals up in age, is that a coincidence, or are they more vulnerable being in their subject?
Yeah, thank you for that. So we have seen from what we've seen across the world, especially in China, where obviously the focus is, they have been mostly in older and infirmed people. Our cases have been all above their 60s. So we have seen that there's not the same kind of attack rate in younger populations under 19. So again, we're learning about this virus and trying to get all the details, but we have seen it have more complications in older and people with pre-existing conditions. Thank you.
Do we know where these people contracted the coronavirus?
Right. So again, this is new and it's evolving. We just found out about these cases over the weekend, so we are in the process of investigating that. When we know more, we'll be able to share.
Can you share any details about whether they traveled, including on public transit at all? And can you also explain why it is that one is hospitalized and then the other is at home? So what is the difference and sort of what are the rules for home quarantine?
Yeah. So without getting into too much of their personal medical history, we in general would like to keep people out of the hospital if we can, right? So that minimizes exposure to other healthcare workers. So any chance that we have to be able to say that somebody is well enough to stay at home, we would prefer that over bringing them into a healthcare setting and exposing employees potentially to that situation.
How many people in Illinois are being monitored?
I'm sorry.
How many people in Illinois are being monitored?
Currently, from all avenues, the people that are being actively monitored twice a day for symptoms is at 286. And that number changes every day as people get 14 days away from their exposure or 14 days away from the area that we are isolating them from. Then people fall off and then people potentially add on, but we're at 286.
There's a school district in Arlington Heights that has sent a notice home to parents about 2 students and 2 workers who've been asked to stay home because they may have been exposed to someone who may have been exposed to coronavirus. But you're not mentioning it, so what's the threshold of when these cases should be made public? Is someone announcing information too soon, or is this something that you're prepared to address?
So as she asked about how many people are being monitored, there are 286 people being monitored, but we are not getting into the details of each of those individuals. If they develop fever and respiratory symptoms, and then they get tested, and then get confirmed, that's when we count them as a case, and that's when we share. But all the people who potentially were exposed, we're not getting into details of all of those individuals.
Can I talk to you about the first responders? I know in Washington State right now, there are about 24 first responders, mostly firefighters, who were quarantined in that state. Are there specific protocols in Illinois on how to better protect our firefighters and first responders? This is a question for both.
Right, so that is part of our Office of Preparedness and Response. We are over all of the EMS work that happens in the state, and so we already have preparedness plans that were associated with the pandemic flu exercise, and so we're just adjusting that to the COVID-19 response, but we're just trying to make sure that is definitely our domain at Department of Public Health, to make sure that in the case of, say, if we moved into a case of widespread community transmission, that we would have enough equipment for our first responders, and that we would give them the appropriate protocols, and that they would know how to respond to calls.
So technically now they're trained and they have all the gear and equipment that they need.
So we have an inventory of all the PPE, and we have access to additional stockpiles, so there's no lack of equipment at this time. No.
What about the resignation recently of the state's chief epidemiologist? Why did that happen? Was she forced out? And how are you handling the situation now without a permanent individual in that position?
So we do have an acting state epidemiologist. In fact, that individual has served in the role in the past for over 15 years. So he is more than experienced. He's dealt with H1N1s, SARS, Ebola. So we are fully staffed in terms of that position. We will be looking for a permanent position, but we are also identifying other partners in the community that are partnering with us in this coronavirus, but there's no lack of expertise or clinical expertise at this point.
We have time for a couple more.
I have a question about the potential economic impact of the virus. Can you talk about your strategic planning or any issues or concerns you might have at this point?
Sure. Let me also just continue the response by saying that the acting epidemiologist has been very actively involved in everything that's occurred over the last week or more. So people should feel comfortable that we have terrific epidemiologists that are in the leadership and also on the team. So, number one, it's unclear what the economic effect would be broadly. I will say that there are expenditures that are being made by the state in order for us to be fully prepared. And I have worked closely with our federal representatives. In fact, this afternoon spoke with Senator Durbin. Earlier this morning, as we mentioned, there was a call with Vice President Pence in which, on both those calls, we discussed the potential for a reimbursement and a broader appropriation bill to help states cover these significant expenses. But, again, this has been about preparedness and making sure that we have all the PPE that we might want in the possibility that things, evolve beyond where they are now. We have stockpiles of PPE today. For all of the first responders and all of the hospital workers, the healthcare workers that we need, and we want to make sure that we're procuring everything that's necessary. So that's the kind of economic impact that we're looking at. But obviously there are broader things nationally that are being looked at, discussion about potentially lowering interest rates and other things that will affect the economy in a potentially positive way.
Can you elaborate on tomorrow's tabletop and help us understand what will go on and what you're going to be looking for?
Yeah, the city is doing its tabletop. I mean, I'd be happy to just say that the August tabletop that we had for the state, which was very much on point to this, is very comprehensive. The purpose of a tabletop in the end of the day is to make sure that you're getting to all the details that would be necessary in the event of contagious virus. And so it's very helpful because you start thinking about every item of PPE, the personal protection equipment that's necessary. You start thinking about all of the people that you might need to cover in some eventuality, and even around things like insurance coverage like we are dealing with today. So those are, it's an exercise that really does help prepare all the agencies, not just IDPH, but also our emergency management agency, obviously state police, and others who are engaged in, the broader homeland security issues.
Governor, we just held a press conference down in Springfield today, and they were somewhat critical of your budget proposal that would withhold some local tax revenue if the graduating tax doesn't pass in November. Would that potentially lead to property tax increases at the local level if the graduating tax doesn't pass in November?
Let me just say that the effect of not being able to have revenue available to cover what is a structural deficit for the state has an impact across the board, I think, on a lot of folks. There is nearly $2 billion, it's around a $2 billion structural difference between revenues and expenditures in the state, and those who are critical of the way in which we've talked about balancing the budget have not offered a real plan for bridging that gap. And so I'm open to every suggestion that is made by people on either side of the aisle about how to do that. My door's been open. I think all of you know I have really worked across the aisle and developed good relationships with people. I know that it's election time and people want to stand up and be critical because it seems like it's helpful to them to do it. But I'm really all about trying to solve the problems that the state has, and so I would just direct them to come speak with me about what their ideas are for balancing the budget.
Governor, today the city, excuse me, the city launched early voting today.
Yeah.
And they're using all these touch screens, and there's some concerns raised about, could this be a potential, problem with the concerns about coronavirus? Should there be concerns about that?
Let me just say that people should not be overly concerned about this. What you should do is follow what I described earlier, the protocols that you should follow, in the flu season. The same thing would be true in any other year, that any surface that you touch that other people are touching, which we do all day long, is a surface that probably needs, for you to go wash your hands or whatever afterward, or when you get home or when you get to the office. People should not touch their faces after they touch public surfaces that other people are touching. I mean, those are the same things that you would do in any other circumstance. So, thank you.
Turn out on election day, Governor?